Oh, so the first one,
all the tile work is actually done.
Saw him yesterday.
A little bit on the entryway into the house, there's an edge.
We all lay
But she's got two
everything went off John's head.
well, I'm hoping that by wearing that thing, at least we give her some
What these guys have done. Well, how's your dad? Seen your dad?
Yes, I'm Sunday.
Well, that's not so much. You know, it's just kind of cool. It's all the sling. You went from care.
So I had a started.
I don't know, driving.
How you sit?
Oh, good.
Well,
No, she's going to play soccer for
yeah.
It's
It's really never seen it down her whole life. This is the closest it gets. Yeah, this gives you so.
like I told my
No, he had last summer. Potato tough. Took too long to get in.
Well, I beat
Where are you going for that too? What are you doing? You'll be out for a long time. Yeah. That is communicated. Your daughter get all set?
When do you think your work is going to open?
When I was up there Saturday and they had a snow on the ground.
Yeah.
It's going to take 30 inches. I never did that.
Okay.
That's all I do.
So no, it's very nice. Thank you for trying to get to know the employee health center. Yeah, great Saturday. So she's almost done. She's first time flying with a kiddo.
She's fine.
Well, that's good.
It's very confident, especially. Yeah, extremely hard. Third. So she's
You know, she's pretty good. She's had to be her. Yeah, she did everything match up early, but you know, it's constantly.
of course the ranger and sheer like that.
So, how are you guys treating them? Did you?
You know, it was just a better
Yeah, I was looking at my email on Friday.
well, they're I sent an email. My
Yeah, there's a lot of
auditions like that.
still working on
Version.
Jennifer now I've got patients working.
I'm fine. So it's over. That's not fine.
Yeah.
How long it will be?
The test, TSO5 EMR form should be working. So the doctor started playing. Yesterday. And
I'm getting a lot.
I will talk to you later on.
Well, this one we should just see at some point and see whether
Period.
Yeah, we are one.
That's okay, too.
One division.
I'll try to see
Right.
Are you with me in clinics, bud?
Thursday? No, not
Oh, you're welcome. Did that answer your question? Fantastic. I thought it would. Yeah. Just use me that way. We got all kinds of.
My buddy Ross, apprentice, was in getting a solar shot yesterday. He said, "You're really helping."
Who's that?
My guy with the solar and
You know, we've got
I don't see the Zolair people very
oh,
often.
the ABPA guy.
Oh,
Apprentice.
that's
We
good.
do have, we do have an IG test thing, but there is probably
Whenever he asks.
I mean, the patient would have to pay something to get that done. It's not free. But if you're interested, I can look for a trial. No, we just give you the kit. But when it goes to the lab, they would then charge. Give it a thought. Just any interest to you guys. You know, they probably would be, but I don't know that. I would have to talk to them.
Apparently it
You're only going to get rid of it.
oh yeah. I am.
Drew, anything you need? We're just about to get started. Remember to unwrap. I forgot to unwrap my sandwich. I'm breaking the rules here. Don't unwrap your sandwich while the speaker is speaking. Give me a second to get to my wrap before you start. It bothers our outside audience. Did anybody park underneath today? No. Did anybody notice for sure that the gate was up prior to 7 o'clock?
Yeah.
Okay, good. Drew, you have any announcement? No. The word of the day for CME credit is Amherst. Our speaker today, an old friend of mine who hadn't been in touch for a long time, Peter Rabinowitz in the School of Public Health and the School of Medicine. I don't know exactly, he changed his topic. I don't see it up here, but he'll announce it for us. Drew will put it up on the slide.
Thanks a lot, Len, and thanks, Drew, for getting set up here. Good morning to everybody. It's bright and early here in Seattle. What I'm going to talk about is something related to, basically, I'm going to talk about allergy eventually, but I'm really going to start talking about environments and environmental health. And I'm going to bring in the whole issue of animal health, which I know as allergists you often deal with in terms of animal allergy. And so I'm going to get to that as well. But being in the Department of Environmental Health and also my background as a physician, I trained both in primary care and then did a specialty fellowship in occupational environmental medicine, where we care about things in the workplace. We also care about things in the environment, anything that really could make you sick, including allergic exposures in the environment. And always felt like the allergy community is the closest in terms of really considering the environments of your patients when you see them and being able to sometimes modify those environments or at least recognize hazards in the environments that could be affecting your patient's conditions. As you know, many other specialties really don't consider the environmental factors in disease, and I think obviously allergy is an exception to that. So I'm going to talk about a couple of things. I'm going to talk about the idea that sometimes when a patient comes to you and tells you about their dog or their cat or another animal that is having a disease problem, that instead of our usual reflex of just saying, look, we're not veterinarians, I don't know what you're talking about, or trying to dispense medical advice, which probably is not accurate for that dog or cat, but really thinking about what potential value could this information be if you hear about some animal illnesses in the household or in the environments where your patients are, and should we be doing anything with this information, which I think there's a good chance that we're going to start getting more of it. And I just wonder in this room, to start off with, has anybody had a patient mention an illness in an animal to you in terms of a household or an environment mention that? Because I started getting patients in our occupational environmental medicine clinic who are coming in concerned about various exposures, telling me about sick animals as well. So nobody in this room has one person? Okay. So I'm going to talk about sort of what you do if that happens. And I'll talk about the this concept that sort of human, because of a lot of events around the world, there's an idea that we need to get more linkages between animal health professionals like veterinarians and human health professionals. And the idea is that the health of humans, animals, and the environment is all connected in kind of a One Health concept. So I wondered again if anybody's ever heard of the One Health concept as a concept. Okay, so we'll be starting from scratch with that one too. And
You got a lot to learn.
yeah, so I'm also going to be talking about really where are there opportunities and potential for some actual communication between physicians and veterinarians in practice. So last question to get started. Has anyone in their professional work contacted a veterinarian to discuss a case? Okay, so let's start with the case then. This is a case that was published in the medical literature a couple of years ago, but it starts off with a case of a Labrador Retriever. And this is a 9-year-old Labrador Retriever that was taken to a veterinarian because it was having trouble getting out of its bed. And the veterinarian did a neurological exam and noted ataxia and nystagmus, and for various reasons, I guess, prescribed an antibiotic, thinking that there was something infectious going on. And just to give you a sense of the way medical care is going for animals in 2014, although this was written a few years ago, despite the amoxicillin, the dog worsened and was admitted to a veterinary hospital. And there are hundreds of veterinary hospitals in Washington State, and the Seattle area has many veterinary hospitals. On physical exam, there was neurological problems going on. The dog had altered mental status. The temperature was warm, 38.5. Even though dogs are a little warmer than we are, this was definitely warmer than normal for a dog. And there were some findings. There was scrotal edema, ecchymoses, and some neurological extensor rigidity. So the dog got a CAT scan, and that's not totally unusual. CAT scans and MRIs are being done fairly routinely on companion animals. And the CAT scan showed dilated ventricles and a mass in the brainstem. And then the dog got a spinal tap, which showed protein which looked elevated, as well as some nucleated cells, and a lot of which were neutrophils. So we're not trained as medical professionals to think about differential diagnoses in dogs, but any ideas what this could be? Is it a CNS malignancy? Is there some sort of mass in the brain that's doing this? Is it the flu? Is it H1N1 or another influenza? Is it something infectious like Lyme disease, rickettsial infection? Is it a toxic problem like melamine poison? Any ideas? Sick dog, neurologic signs, some fever.
You said there was a mass in the brainstem.
B or C or E. Okay.
Lyme disease or melamine poisoning.
Lyme disease or melamine poisoning. So the provisional diagnosis with the information they had was that there was some sort of encephalitis inflammation going on, and that there was hydrocephalus with dilated ventricles, and that possibly this was a cancer process. Labrador retrievers and other retrievers have a high rate of cancer, and so they thought this was maybe cancer. And at this point, they sort of deviate from medical care and decide there's really not point in going further. The dog's not going to be able to be saved, and so the dog was euthanized. Another thing that happens probably more in veterinary care than in medical care these days is an autopsy was performed, which is called a necropsy when it's an animal. And it had a bunch of findings: subarachnoid hemorrhage, mononuclear infiltrates in the small and medium-sized capillaries, sort of evidence of diffuse vasculitis involving the scrotum, testes, and the eyes. And as they say in the New England Journal, a diagnostic procedure was performed. And the reason this was published in the medical literature was that 2 days later, the owner of the dog goes to her own physician and says, I don't feel so good. I got nausea, vomiting, fever, and my dog died of cancer 2 days ago. They put the dog down, but the dog was really having some similar symptoms to what I had. So here's the dilemma. You know, a person comes in, they start telling you about their dog and some symptoms. We're totally unfamiliar, untrained to know even what to make of a basic differential diagnosis. So I think the doctor probably kind of dismissed this thing about dogs and cancer and the same complaints, thought that the patient had gastroenteritis, sent her home with fluids. She also did not get better. She got worse, came back feeling that she had a fever. She was confused, and there was no focal neurologic findings, no rash. So she was admitted to the hospital, and with a fever and a white count that was sort of unremarkable. Platelets were down a bit. Sodium was down just a little bit. Hemoglobin unremarkable. So it was felt to be a fever, not a definite source. She had a bunch of cultures drawn. They started her on a quinolone, levofloxacin. She got a little better, but she really didn't totally improve. She got serology that came back negative for Lyme disease, negative for Ehrlichia, and she was, this was on the East Coast, by the way, so that was pretty common to do those kind of things. She was discharged saying that, we don't know what you got, but you're a little better with the levofloxacin. Here's some outpatient antibiotics, and continue to have headaches and malaise, and you've got fever of unknown origin, but you seem to be getting a little bit better. But she really didn't totally improve. So any idea now? We got a dead dog. We got a woman with a fever that's a little bit better on levofloxacin. Is this seronegative Lyme disease, hypersensitivity pneumonitis from something in the house, or is this H1N1 influenza, melamine, or Rocky Mountain spotted fever?
Looking like E.
Which one? E, Rocky Mountain spotted fever. So what happened was that the veterinarian had sent the dog's tissue to the CDC, and they tested it with spotted fever rickettsial antigen, and it did show, this is the slide of the testes, and it shows red staining for rickettsial antigen. And again, this was a veterinarian sending directly from the veterinary hospital to the CDC a sample like this. And so what happened was the veterinarian contacted the doctor and said, look, you have a patient who had a dog who had Rocky Mountain spotted fever, and they should know about this. And the doctor then contacts the patient, who's still not feeling better, gets her on the correct medication for Rocky Mountain spotted fever, which is a doxycycline. The patient got better, and the serology acute convalescent titers proved that it was Rocky Mountain spotted fever, which, as you know, is a centripetal rash caused by a dog tick, and often misdiagnosed in people, because the classic triad of a rash, a fever, and a tick bite is only present in about 20% of patients at the time of presentation. So the diagnosis is often delayed, and as you know, if untreated, it can be a very, very serious disease. But what a lot of people don't know is it's also serious in dogs. It causes severe disease, like in this dog that was there. It can cause sort of a diffuse vasculitis, and really is something that can kill a dog pretty easily. So the question is, what's the connection between the dog and the person? Did the owner become infected when the dog licked her? Was the same tick that bit the dog able to bite the person as well and infect her? Did she take the tick off the dog and get infected, which is certainly a possibility, but she didn't give any history of doing that? Or was it the dog and the owner both got infected from the same tick-infested environment? Any ideas on that?
Where did it take place?
Where the what?
What part of the country?
This was in Greenwich, Connecticut. So it really was D, which is that Rocky Mountain spotted fever occurs in a bunch of places in the country. It occurs in sort of a patchy distribution, and when there's just local little pockets of the ticks and the pathogen. So it's really probable that this was an area with a high prevalence of Rocky Mountain spotted fever, and that this was a tip-off that, the dog case should have been a tip-off that the person was also at risk, and a weird febrile disease should be considered Rocky Mountain spotted fever, as well as some other things. Now, there's been a bunch of other cases also published in the medical literature where basically the connection was not made in a timely way. Here it was kind of a delayed diagnosis, but in even more delayed, there was a case where one dog belonging to an owner got Rocky Mountain spotted fever and died. Then the second dog also got Rocky Mountain spotted fever and died. There was no communication with the physicians. The owner then, 2 weeks later, developed symptoms of Rocky Mountain spotted fever. The diagnosis was not made in time, and the person died from that. So again, these sort of signals in the environment that maybe we should be listening to more in this situation. So I'm going to give you one other case, which has to do with cats. And this is a case of a pregnancy, also published in the medical literature in the last couple of years. 28-year-old woman, she's pregnant, and she goes to her obstetrician saying that her cats are sick. And she's got two short-haired cats, Midge and Pepsi. They're 3 years old. They've been sick for 3 weeks. They're gagging and retching, and they're treated with ranitidine, an H2 blocker. on their previous visit 3 weeks ago, but it's not helping very much. So here's an obstetrician having to deal with cats that are retching and not doing well. And when the veterinarian evaluates these cats, they've got diarrhea, vomiting, anorexia, lost Pepsi has lost almost 1 kilogram, which if you're a cat is not a good thing. They're dehydrated. Midge has sway and gait and fine tremor. Pepsi's drooling, hypersalivating. They're admitted again to a veterinary hospital. So, pregnant woman worried about her cats. The cats are really not doing well, vomiting, all this stuff. Any idea what you'd be if you were the obstetrician and they told you their cats were sick? Any idea what you'd think about here? Yeah, so that's the usual response we get from medical. He's like, cats, pregnancy, toxo. Does toxoplasmosis make cats sick? Generally not. Occasionally it can, but generally they're pretty asymptomatic. So even though we worry about cats and toxo as sort of an exposure, like sounds like a bad idea, we don't want congenital toxo, they actually don't get sick usually. So in the vet hospital they do lab tests, they do, and I can tell you that care like this is going on in Seattle all the time. There's a tertiary care. There's a couple tertiary care referral centers with MRIs. They have linear accelerators to treat cancer and chemotherapy. They're doing renal dialysis. It's pretty interesting. It's like a parallel universe going on right in our own communities with this kind of treatment. But these cats got some basic blood work. They showed some anemia, elevated liver function tests. And they were given IV fluids and ranitidine and another diagnostic blood test was sent.
What's the logic for giving these cats ranitidine? I'm struggling with that. They think they have ulcers. I mean, why are they giving the cats ranitidine?
Yeah, I mean, again, I'm not a veterinarian, so I'm not sure, but I think they do get ulcers or some sort of gastritis, and they are given ulcer medicine for that. There's many human pharmaceuticals are given to animals for various reasons like this. I don't know as much about ulcers in cats. But and as the other thing that's happening, as you know, is that many pharmacies now, whether it's Safeway Pharmacy, Bartell's, and things, often are dispensing both veterinary medicines and human medicines at the same time. So people are going there to get a prescription for their animals, prescription for themselves, and there's a chance for things. So what's going on with Midge and Pepsi? Was it toxo, feline peptic ulcer disease, H5N1, lead toxicity, or hairballs? Which one do you think? Yeah, so think about that. Basically, the vet sent lead levels for these cats, and Midge had a lead level of 135. Now, I know Seattle's not a really high lead. I came from New Haven the last year, so we had a lot more lead, I think, there than here, but you do see lead poisoning in Seattle sometimes, but 135 is not good. Normal for a cat was considered less than 25 micrograms per deciliter, about what we used to consider normal for a human adult. Pepsi was 87. As you know, when you're a human and you start getting up around 60, 70, you start having some risk of hemolysis and some neurological effects. And when you start getting up to 90, 100, you can really start getting into the encephalopathy range and real risk of very severe consequences. So both these cats were started on chelation therapy, EDTA, which we use occasionally for people for lead poisoning. One of the cats survived, but the more exposed one died. And the veterinarian contacted the owner and said, you should talk to your physician. And the patient who was pregnant was able to get tested for lead, and her level was 40, which is a level where you could certainly have enough passage to the fetus and have adverse effects for the fetus at that level, with neurological effects really seen above 10 micrograms per deciliter for the woman. So the woman and her husband were getting the baby's room ready and using a blowtorch to take off the paint and the wallpaper in the room, which is not a good idea if you live in a house with lead, I guess. It turns out that it makes a pretty good lead fume when you start using the blowtorch on the walls. So basically, why is it that the cats had a level of 137 and the woman had a level of 40? It's, think about how cats are in houses and how they have a slightly different exposure to the environment than, say, an adult does. They are low to the ground, so anything that's sort of in the dust and sort of sitting around as a fume, kind of low to the ground, they're going to have more exposure to. Anything that gets on their fur, they're like, like a fur duster going through the house, picking up all the dust, and then they are licking their fur. They stay in the house more than we do. Many times we have now indoor cats or indoor dogs for various reasons. It's hard to just let your animal roam, especially in a city. So they tend to be in the house often 24 hours a day, whereas we go to work, we go take weekends somewhere, we go around, and they have just more constant exposure to the household environment. And there's a question that, for certain things, they may be more susceptible than humans to a particular exposure in the environment, such as lead. And they may show symptoms at the same concentration in the blood sooner than we do. So they're more exposed and they're potentially more susceptible. Dogs are also great at eating dirt and sort of picking up everything in the environment. And they also have been reported to be what we call sentinels for lead poisoning in children. So we've got these animals that we're sharing a lot of time with right now. My understanding is that there are more dogs in Seattle than children in households. So that's a statistic I've heard. I don't have a good source for that. But, we see many, many people with dogs and cats in the house. And it's just part of life these days that households and families often include a dog or a cat or a couple of them and other animals that really are sort of part of the family. And the question is, can these animals really be sort of like canaries in coal mines and give some of the information that the canaries used to about hazards in the environment?
Do you have any idea what the veterinary bill for these would cost?
It's not cheap, and there is veterinary insurance coming out more, but it's amazing what people are willing to pay for an animal sometimes. It can, you do a CAT scan, it's a couple $100 at least, and blood work, it's, anybody who has had a dog and taken to the vet, you really see what medical care actually costs when you don't deal with third party. What's that?
They collect it all.
They collect it all. Yeah, right. You want your dog back, you got to pay.
I can tell you exactly what X-rays and blood tests cost. If you want to know. I can give you the numbers.
Yeah, right. I mean, it's right. They don't. But veterinary insurance is coming in a bit more because some of these bills are just ridiculous. But I've been in the situation where my little kid is crying about the dog, and what am I going to do? You're not going to. You don't want to make your kid totally upset about this, so you're going to do everything for the dog, and you love the dog, and so you start just spending more and more on more procedures and tests and things like that, or it can really escalate. But there's been a number of cases. I mean, the literature, when you start looking, has lots of cases where animals really have been sort of interesting sentinels of environmental hazards, both from when we took canaries down into coal mines. Something like methylmercury, the largest outbreak of organic mercury poisoning in Japan, when they were pumping mercury into the bay and the fish were getting through the food chain very loaded up with mercury, and then people were eating the fish and developed neurological damage in the newborns for the pregnancies, and that was called Minamata disease. But before that, several years before that, the cats all got sick with neurological disease called dancing cat disease because they were eating even more fish, and they developed, about 5 years before the women started having problems with pregnancy, the cats all died because of the amount of mercury exposure they were having. There were pet food poisonings around the country with melamine a couple of years ago, even before it ended up in infant formula in China and other places, because people had been using melamine as a substitute to bake the protein analysis in pet food. And pet food is a huge industry, often made in other places and brought here. Sometimes it is also full of things like salmonella. And also cancer in dogs. Dogs tend to be a better model for cancer than many of our rodent models. And they've done studies, sort of epidemiologic studies, of dogs that have been exposed to lawn chemicals and asbestos in the household and getting things like mesothelioma from these kind of exposures. And if you're a person, the median time to develop mesothelioma from asbestos exposure in a house, any idea what it is? Any of the fellows want to guess? How long does it take you to get mesothelioma from that asbestos piping in the basement?
20 years.
So it's actually around 30, 35 years. It's a long latency for that particular type of exposure. Whereas if you're a dog, you got dog years going. So it's more like 5 or 6 years for a dog to develop mesothelioma. So again, the shorter latency of some of these things can really sometimes help find out that there's something in the environment. So what we're sort of talking about is it worth it, or is it possible to move from our usual approach to animals? And that, and I think in allergy, you think about cats, you think about dogs, you think about birds, you think about all the things that animals can do to you. And in a way, it's almost like us versus them. Like if you're sick, get rid of that animal that's making you sick, or you're going to pay for it, kind of thing. And an infectious side, of course, we think about zoonotic diseases. We think about Ebola coming possibly from bats. We think about MERS in Saudi Arabia coming possibly from camels. We think about things that you could possibly get from your dog, including ringworm, as well as things like Giardia, but maybe leptospirosis and other scary zoonotic diseases. So it's sort of, if there are, you sort of think if there aren't animals around, maybe we'd all be healthier, and we should just sort of get rid of them somehow, sort of isolate them from ourselves in this kind of us versus them paradigm. But as we think about some of the cases that I've talked about, is it worth thinking about a slightly different paradigm, which is sort of a shared risk, which is we're now starting to share a lot of environments very closely with these animals. And this is kind of the way households are in the United States in these days. And should we sort of think, what kind of risks are we sharing, and what could we maybe learn from the experience of the animals about the environment, and what's a healthy environment, what's not? Can they be sentinels for some of these environmental issues? And as well as all the, the positive psychosocial human-animal bond things that seem to be bearing out that there's some psychological benefit to having an animal. And there's surveys that show that people kiss their dog more than their spouse and things like that, which is not necessarily good, but there's a lot of psychosocial bonding that goes on. And so because of this convergence of human-animal medicine, where more than 50% of the households have pets, and the animals are often getting very sophisticated care, and emerging diseases are usually are often zoonotic, coming from animals to people in origin. There's just a sense that we have to kind of really consider the kind of training we're giving in medicine and veterinary medicine. And traditionally what we've done is we've separated human and animal medicine. And for instance, Washington State is a perfect example. We have the medical school currently in Seattle, and the veterinary school was placed at a land-grant university in Pullman at Washington State, and it's about 5 hours drive, and they're just, because you have that kind of separation, which is true in many states where often the vet school was put out in a more rural area, you've got very little contact between the training of the veterinarians and the training of the physicians and the professional contacts they have after that. So one of the drivers to be looking at this whole idea of One Health, of human, animal, environmental health together, is this idea about emerging infectious diseases, that if you look at the last couple decades, and we're dealing with this with Ebola right now, obviously, that most of the really bad diseases in the last couple decades have been basically animal diseases that for various reasons have crossed into people and are causing all sorts of problems. A lot of them are these viral diseases, like many of these, but other diseases, bacterial infections, and even antibiotic-resistant strains can often be related to sort of contact with animals. So the One Health concept, which has really come in sort of in the last 6 or 7 years, is the idea that we should be thinking about all the species, and even if we're trained as human health providers, we should think about how we can possibly partner more with animal health providers to sort of talk about integrating human and animal medicine as well as the environment, because the environment is really where we all kind of come together here. And this concept has really been endorsed by a lot of health agencies, including CDC, which has opened a One Health office, World Health Organization, USDA, some of the international United Nations organizations, the American Medical Association and the American Veterinary Medical Association have passed resolutions saying that physicians and veterinarians should really talk together and somehow work together. And the Gates Foundation has put out some calls for kind of One Health projects. And the Washington State Department of Health has also kind of adopted a One Health model for a lot of the types of work they're doing around the state on the public health side. So I'm going to talk about one more case, which is a little closer to home for you as allergists. And it was a case where I unfortunately don't have all the data, but I'll sort of give you the basic idea and see what you think. Because I haven't had a chance to present this to an allergy community yet. So this was a case I saw in our Occupational Environmental Medicine Clinic at Yale. Again, people come in to see us, sometimes referred by allergists if it looks like the problem is related to something definitely like a moldy building or something like that. We'd often get referrals from allergists for that. And she was saying that she had a lot of complaints that shouldn't seem totally unfamiliar to any of you. She had asthma, which she said really she didn't think she'd definitely been diagnosed with asthma until very recently. She did have a history of allergies in the past. She had a history of some rhinitis and sinusitis in the past. But she said that all of these were worse, and she also had rashes and anxiety, and she dated all of these to moving into this particular apartment about a year and a half ago, and had been going to multiple doctors, had noticed mold in the apartment. And what she also said was that her daughter had been having some symptoms, was having headaches, had a lot of upper respiratory symptoms that just didn't seem to resolve easily, and that she noticed some visible mold in the apartment around some of the plumbing areas. There were some areas that looked that they'd been leaking before, and there was some visible mold on the walls. But what she wanted to talk about the most was the fact that her cat, who had been fine before, had moved into the house and then had developed asthma since moving into the apartment. She was having a dispute with the landlord. I don't know how much you deal with these kind of things, but the landlord, she was trying to get out of the lease, and the landlord was refusing to let her out of the lease, and she was hoping that if she had a letter from a doctor saying that it was medically necessary for her to leave because of the mold, then she'd be able to break the lease. So she sort of had a little bit of a legal, medical legal agenda as well. And basically the landlord was saying, I don't believe you. You're not getting out of the lease. So
That happens here too.
that happens here too. Yeah. So
Not infrequently.
what's that?
Not infrequently.
Not infrequently. So the case, the woman had some testing. Her total IgE was up a bit. She had the information I was able to get together on her. She'd seen an allergist and done some things. I think she'd had some skin testing, but I knew that she did have a mold allergy panel that we did that was negative for molds, and I believe mold testing at the allergist's office with skin testing was also negative. And she was also negative for cat antigens, at least by RAS testing. And so one of the things that then I was trying to, you probably deal with this sometimes too, where does this sound familiar? You have a patient who has a lot of allergic symptoms. It sounds like it's a moldy house, it's musty, but when you actually test them for molds, it's not a totally remarkable panel. And the question is, did you test for the right mold? So you got 5 or 6 on your panel, but there's hundreds of molds out there. So is it just a matter of which species? Does that sound like a familiar situation? Because we would often, at Yale, we would clinically say, look, I know her testing's not that remarkable, but clinically this looks like somebody who is bothered in some ways by these molds, and this is not. I think we should get her out of this situation. So what happened was that the cat got tested by the veterinarian, and the one thing is that heartworm apparently looks sort of like asthma, so they did a heartworm test that was negative. But the cat was actually positive for Fusarium mold and also for a storage mite that is associated with high humidity. And so the woman came in and wanted me to know about these veterinary results. And it was interesting that when I looked at the veterinary lab test, it was telling the person, because of the health risks that molds may pose, identification of sources of molds of remediation is recommended, and immunotherapy should be considered for the animal. So they do immunotherapy for cats and things like that. So, and cats apparently can get allergic to humans. Just so you know, you probably know that. But it's interesting that basically people are going to a veterinary, taking their cat to a veterinary lab, and then the veterinary lab is giving things that are coming back saying, maybe there's some mold issues that are also relevant to human health. So that somehow patients who have animals may be finding out that there's some allergic issues or some environmental issues that they're dealing with because of the animal issue. And in this case, I think having the information about the cat with a positive mold, we were actually able to talk to the landlord, and I think it somehow helped sway the landlord that this really wasn't a good place for the cat or the person unless they remediated the mold. So, has anybody ever heard? This is a different lecture today. So cats get asthma.
Before you move on, what did you think was wrong with the human in that case? Because normally here in the Northwest, I tell people who think they're allergic to mold and who are not, that they're just bothered by the volatile organic compounds that molds, and the odor is what they confuse with mold spore allergy.
Right.
And
so that's what we would sometimes. I mean, obviously, we had people coming to us who had been totally terrified about mold. First of all, they've read everything on the internet that mold is a neurotoxic, agent. It's causing cancer. It's rotting their brains out, and we tell them we didn't think so, and but that there are some of these mycotoxins. So there's volatile organic compounds, but I think the mycotoxins themselves can be irritating as well as allergenic. And so we would tell them, sometimes we would tell them, look, either we're missing the mold that we should have tested for in the panel that we did, or the skin testing you had with your allergist, so that it's possible you are reacting to some molds that we're just not getting on our testing panels. Or you are, just as you said, you have very sensitive mucous membranes and things, and you are having these irritant effects from either some of the mycotoxins, the trichothene, or certainly other things in the household. If the mold can be a sign of poor ventilation, then you're going to have all the other indoor air problems, VOCs, and things like that. But we would basically say, just from the temporality of what you're telling us, this seems like a not good environment for you somehow, and it's worth remediating the environment or try being out of it for a while and seeing what happens. But you're not going to die from the mold. That was something we often had to really stress to. So, what about the cat? And the fact, so I want you to be aware as, asthma specialists, allergy specialists, that cats apparently get a syndrome which is considered feline asthma, which is really closer to human asthma than almost any other animal model. So even though some of the research about asthma that goes on uses rodent models and things, as I understand it, mice really don't get asthma like humans get asthma, and you can get their airways a little twitchy, but it's just not the same type of physiological complex, whereas cats get something very close. And it's basically you've got airway hyperreactivity. You've got eosinophils that they do lavages and find eosinophils. You can't really do spirometry on a cat, but you can see on X-ray and you can do a CAT scan on a cat, and you can see really typical changes of hyperinflation and airway inflammation that very much resembles human asthma. And so there's a real interest in sort of clinically learning from some of the things that cats are going through about human asthma as well. And there's let's reverse this slide, but this is just how similar feline asthma is to human asthma. That it seems to be, and you know a lot more about Th2 responses and things like that, but it is immune-mediated, and it seems that they are reacting to things in the environment like molds, pollens, and dust mites. They develop coughing, wheezing, respiratory distress. Many times owners will think they're like coughing on a hairball for weeks or months at a time when it really is asthma. And it just physiologically, again, resembles human asthma. Eosinophilic airway inflammation, reversible airway obstruction, and airway remodeling. So they're not the only animals that get these allergic diseases. Dogs can get a bronchitis and pneumonia that looks very close to asthma as well, not quite as close as the cat asthma. And then dogs and cats get atopic dermatitis, and especially dogs, and it's a big problem. It's something that vets spend a lot of time treating, and they often talk about manipulating diet and things, but it looks like other environmental allergens play a role as well. And so this is a very frequent reason why animals come to veterinary care. And even in barns and things, horses develop recurrent airway obstruction that also looks like it's really related to indoor air quality and exposure to molds and things. So these are these are just animals spending lots of times in the same environment that our patients are spending time in, and we're spending more and more money to diagnose and treat them, and it just sort of brings up the issue of what we should be possibly doing about it. Irritant exposures are also possible for feline asthma, so they've shown to react to deodorizers and dust and a lot of the things that people react to. And again, this is how you diagnose it in a cat. Not that different from humans, although they're pretty quick to do things like tracheal lavages, and they use radiographs instead of pulmonary function testing. But the treatment is very similar. The bronchodilators and steroids, often long-term, and then immunotherapy is being used more and more. So the question is, should information flow between, say, allergists and the veterinarian who's treating the animals for a possible allergic thing, or should it flow because of human allergy to animals? If you're dealing with as you know, you often will have a pet in the house, and the people absolutely don't want to give up the pet. It's a big psychosocial issue. Is it worth doing any kind of management with a veterinarian to look at ways to minimize the exposures as much as possible of the animal to the people, and do something about that? And beyond actually trying to reduce exposure of people to animals, is there a role for talking between human health people and veterinarians about these kind of shared environmental risks? And if the cat gets asthma, is that something that should be a tip-off to, say, the primary care doctor that maybe people in the house are also at risk for an allergic event? So I really don't feel I can tell you much about animal allergy that you don't deal with on a daily basis and know already. You should obviously know that many non-allergists think that it's all related to, cat asthma is related to being allergic to cat hair, and it's, as you know, it's not the hair, it's really some of the antigens that are on the hair. And as far as I could tell, talking to veterinarians, talking to other people, that veterinarians feel there's no type of breed of dog or cat that's truly hypoallergenic. So all the money that goes into these breeds, that it's not truly non-allergenic, and someone's making a lot of money claiming some of these things. Oh, wondered what you guys think. Are you finding that people get that special poodle that is non-allergenic and then their allergy problems go away? I mean, is this because I think it's quite a moneymaker for the pet industry to claim that certain things are. Do you advise people to get a less allergenic pet? Or
there was an abstract at our national meeting, I think 2 years ago, where they compared 6 different breeds.
Yeah.
And the only one that had lower levels were leader dogs for the blind. And the person who did the paper really didn't know why. They thought it had something to do with behavioral training. It didn't make any biologic sense, but that's the one paper I remember.
But all the breeds that are
all
talking
the other
about
things,
things.
Portuguese water dogs, and
right.
There's no truth to that. To my knowledge, anybody else disagrees?
Most of them were higher than.
They were actually higher. Yeah. So that's a real scam if it's really not true. Yeah.
I think it goes back to that irritant effect.
A lot of
Yeah.
I think they're allergic to dogs, really just are sensitive to the odors of some dogs.
Oh, really?
Hairs.
Just the odors, yeah.
And have more troubles with the labs and the golden retrievers that kind of are a little bit stinky. And do much better with the dogs that don't have any odor.
Interesting. And you find that when, you're testing them for allergy and things, it really ends up being more of an odor.
Because they're usually not negative.
Right, that's negative, sure. Right. So take claims about truly non-allergenic breeds with a large grain of salt. And the last thing to think about, is, how as allergists, I'm just really interested to hear from you about how the evidence for this kind of hygiene hypothesis is developing where, as you know, some epidemiologic studies have suggested that if you grow up in a household where there are animals or you grow up on a farm, that your risk of asthma or atopic dermatitis or certain other allergic conditions may be less because of some idea that if you stimulate the immune system early or even prenatal exposures to things in the environment may create a healthier immune system than not having exposure to some of these really complex antigens at different points in your life. Obviously, there's some zoonotic disease issues involved with this kind of close contact with animals, but it definitely is a little bit of a stimulation to your immune system. And do you, as far as I know, the literature on this continues to be pretty inconsistent, with some of these studies suggesting a hygiene sort of a benefit to exposure to dirt and farms and animals, coming a little more out of the European literature than out of the U.S. literature. But what's your consensus of hearing about this, about people that are trying to live in a city and try to absolutely have these aseptic lifestyles where they have no exposure to anything, and whether do they come concerned about whether that's good for their kids or bad for their kids, or how much exposure you should have or get them? Everybody should eat a little bit of dirt. Is that any thoughts about that? Does this seem like the hypoallergenic dogs? Just a lot of. Is there something? What is the right balance? Having obviously we've evolved with some of these animals over time. We've evolved with our immune system being primed for a lot of different typical things that we don't always now get in an urban environment. Is that?
I mean, the strongest papers came out of Germany mostly.
Yeah, it was really out of Europe, yeah.
Barns and homes essentially being one structure. In an urban environment here in Seattle, I don't think we discussed it too much. It seems to me almost that people have moved on from this. The next hot topic is the microbiome.
Yeah.
You don't hear people really talking about this, but I welcome anybody else's opinion.
So there's a recent paper, the Amish women that are milking when they go to labor and delivery, they have a much lower incidence of asthma in their offspring than their same genetic stock in Switzerland and Austria.
Because of prenatal exposure to the cows and everything. Or is it
much food allergy, in particular, much less than the Amish than the general population there in Pennsylvania.
Of course, they also eat a lot less refined foods with peanut oil added to everything, or corn oil. Do you think they have a pure diet, or do you think it really could be some of the farm exposures?
Well, I don't know about the food aspects of that.
Yeah. So we keep getting these sort of ecological studies that make us wonder. And as you said, there has been a growing interest in the microbiome, where we think that it is playing a huge role. The gut microbiome, at least, and possibly the skin microbiome as well, is playing a huge role in sending messages to the immune system about what is good and what is bad, and I think that as we look at microbiome effects, one of the things that's coming out is that people who live closely with dogs seem to be sharing a fair amount of microbiome with dogs, especially on the skin microbiome. So when it comes to skin issues, I think adults don't seem to share as much gut microbiome with dogs as kids may share more because of this kind of contact. So that as we sort of think about the environments that our patients are growing up in, animals really could be affecting us not just through straight antigen exposures, but possibly with a certain amount of microbial exchange, that there just may be more, if you live in a house like this, more dog-type bacteria becoming part of your normal flora than if you lived in a house without dogs. And I think there may be bad and good things about that, but I think it's probably something we're going to be understanding more as we look at this microbiome more closely. So, so for various reasons, I think you should just sort of possibly keep an open mind about being able to get some information from what animals are doing in households where people are also living, and just that if, in terms of how hard it is to actually talk to a physician or have this kind of, it's, for instance, I can refer a patient, and you can refer a patient to a physical therapist, to a occupational therapist, to you can refer them to a dentist, you can refer to all sorts of different health professionals, but you really can't make a referral to a veterinarian. They're just not considered part of the health team. They're not reimbursable. There are some practice boundaries where veterinarians are really not supposed to practice human medicine, and we're not really supposed to treat dogs and cats. And then there's some HIPAA issues about who do you talk to about medical situations of your patients. Medical record systems, veterinary practice, just like human medical practice, is becoming much more dependent on EMRs, and so we're developing, again, sort of a two-tiered or two-track EMR systems, and as far as I know, there's really no interaction between the two medical record systems, but potentially there could be if there was an interest in, for instance, making a flag if a cat gets asthma or has a definite environmental effect. Should that be something that would be available to the allergist or the primary care physician seeing that same patient? We don't have protocols for that or experience, but I think to me, it's sort of inevitable that as veterinary care becomes more sophisticated, we're going to be in more contact and have to think about what kind of contacts are useful and how should we sort of manage that best. So I think in the future, there are some very smart veterinarians that I've run into that are very impressive and sometimes are more aware of environments than the average physician, I would say, because you simply don't think that you can take an animal and put them in a terrible environment, a terrible cage, a terrible pen, a terrible stall, a terrible household, and have them be healthy. I think veterinarians just sort of instinctively know that habitats are important for animals, whereas in human medicine, we tend to think much more like people should adapt. You know, you're in an allergenic environment, take a medication. It's too cold, put on a coat. You know, we think, you know, if your diabetes is out of control and you're sedentary and things, just take your insulin. So we tend to think that environments are not always the main thing, whereas veterinarians feel that it's totally integral to their health. And I think allergy, again, is an exception to that, where you realize how important the environment is. So there really is some potential cross-discipline education that can happen. And I think, again, we never go to CME trainings with veterinarians, and there may be opportunities for more contact like this that would lead to potentially more cross-disciplinary contact and exposure and possibly even interaction between the medical record systems. So just think about that in the future, and if a patient comes to you and says their animals are sick, maybe take a second, don't just blow it off, and think about what you might learn from it. So we've got a center at the university where we're trying to actually work on these kind of linkages between human and animal health, and be real interested in any contact with any of you and some of your cases or any other efforts in this way. So thanks a lot.
Thank you.
Yeah.
I read a few years back of a scientist in California who was trying to splice the FeLD1 gene and the CanF1 gene out of cats and dogs. Has that gone anywhere?
I've heard that too, and I have not seen the actual results of the breeding, but I know that was an active effort to try to do that. I haven't seen
that guy was a quack.
The report of it, but yeah, he was a quack. Yeah, I never saw the animals actually appear.
It's not Wakefield. He didn't move from England to San Francisco.
No, he's not bogus. The data that he was presenting.
No. So it's not legit.
I would think if you took that out, you wouldn't have a cat or a dog anymore. You change their biology too much.
You think that one antigen is so important?
I don't know, but I'm happy building.
I've never heard any success in that.
David, he was charging up to $50,000 an animal.
Yeah.
And then he got a big stock run up from his company, and it was all fabricated.
Amazing. Yeah, that's why I think take this with a large grain of salt.
Yeah, I have one question. This is so intriguing to me that, and I try and get the speakers that you know for these sessions. If you know a good academic veterinarian, I'd like to have them come and talk to us next year and move this perspective and hear their perspective on this, because this is really eye-opening.
We had a really great, we put on a conference actually 2 weeks ago in Seattle called Zoobiquity, which was it's the 4th annual conference, started at UCLA in the medical school there by a cardiologist who was trying to bring veterinarians and physicians together. And so we brought a guy from Michigan State who's an expert on airway disease. He actually studies it both in humans, but then he clinically, as a veterinarian, has a practice with cats, and he gave an incredible talk about cat asthma. So I could see if I could give you his name, but I could also see if there's anybody more local who could come talk.
That'd be great.
Yeah, I'm really interested in that.
There are a couple of local companies that do pretty good air sampling, and they're legitimate. They actually do mold remediation and sampling. So they come with a volumetric sampler, and they tell you exactly what they find. So there's actually a few companies I know in Everett that actually do a pretty good job of analyzing these environments and telling you what's there.
Yeah.
So that's, I think if we're going to start looking at the interaction, we're going to have to find some people that have gathered the data that will give us information that we need.
Right. And you have to also be careful, as you know, with the industrial hygiene companies. Some of them are out to just charge a ton of money for the testing and then, recommend these incredibly expensive remediation. So you need to find the ones that are making reasonable things. And but I think the University of Washington, I think this can also help with consultations in households as well and get sort of useful information there.
If you have a list of companies that you trust to do that, and you send it to me, I'd send it out to everyone because we need that.
Okay, let me find out about, because certainly in Connecticut we found that some people were real rip-offs and some people we really could trust their basic advice. You have to take mold testing in environments with a grain of salt. If you have a moldy carpet and you do an air test and then you stamp on the carpet, it'll totally change your levels. And so you have the way you take the samples. It's very hard to get comparable results for certain things. You have to be careful with that.
I have one company right now, so Joe, you guys are really pretty good.
Great. Well, I'll try to get you some information. I'll find out what the environmental health department might have a consultation service for that too. So.
Exactly. A bunch of first talkers.
Great.
That's right. Excellent. Thanks so
Thank
much.
you.
Thanks for doing that.
Oh, yeah, for sure.
We should have the author of that book you gave me to read. Man, I have to come too. What's that? The guy that wrote that book you gave me to spill over. Have him come to it. This is becoming a bigger and bigger issue.
Did you watch it?
Yes.
Find my house?
I gotta find this house, so we go wandering up the hill. So my wife talks to me. We want to have a family reunion here.
It's a 5-bedroom house. Accommodates our. Get inside. The inside is floors or stone, the bathrooms or
We bought property and it was tear down. We bought it